The broadcast is now starting. All attendees are in listen-only mode.
Hello everyone and welcome once again to Question Lab. Tonight's topic is the musculoskeletal system, and leading our discussion once again is none other than Dr. Paras Vicaria, and he's going to introduce himself to you now. Paras.
Thank you, Sean. Hey guys, my name is Paras. I work in dermatology and I'm also an RX coach with USMLE-Rx. So I work one-on-one with students such as you guys to help prepare y'all for the USMLE Step 1, Step 2 CK, and any of your own exams or school exams that you might have as well. And I'm happy to help lead tonight's session.
I know I mentioned RX Coach earlier. RX Coach, like I said, is our one-on-one tutoring and coaching program. We'll talk more about that later, but what I do want you to know for now is that the methodology we'll employ tonight is similar to the methodology we use in our RX coaching sessions. So without any further ado, let's go ahead and get into our first question of the evening. As you can see, our answer choices are covered up. That is by design. We do that because we don't want the answer choices to guide or dictate your thought process. We don't want you to see an answer choice that you may be unfamiliar with that may cause you to panic as you're trying to answer the question. So I've gone ahead and removed those for you. After that, we'd like to begin with the lead-in or the last sentence or the question itself. And the reason we do that is because we want you to know what the test writer is asking so that while you're reading that vignette, you're able to pick up on all of those relevant clues and not have to waste time and reread that question on test day. So let's take a look at that lead-in together. Which of the following would most likely be detected on laboratory evaluation? Which of the following would most likely be detected on laboratory evaluation? After that, we like to ask our students how many steps they believe each question will require. An example of a one-step question could be where you're asked for the diagnosis. An example of a two-step question could be where you're asked for the treatment for a diagnosis. And an example of a three-step question could be where you're asked for the mechanism of action for a treatment for a diagnosis. So with those examples in mind, please let us know in the question box how many steps you believe this question will require, and then we'll move on to that vignette. So I'll give all of you a few moments here to respond in that question box. Probably a couple more seconds here. All right, see the responses coming in. Let's go ahead and take a look at that vignette. A 36-year-old woman comes to the clinic because of a 2-month history of difficulty and discomfort swallowing solid foods. She has no trouble swallowing liquids. Her past medical history includes years of hand sensitivity to cold weather with finger paleness and pain. Physical examination reveals thick and slightly edematous skin in the hands and 3 small subcutaneous nodules on the right forearm. Which of the following would most likely be detected on laboratory evaluation? I want all of you to start thinking about the important clues in the vignette and lead-in as I hand it off to Paras.
Thank you, Sean. So what we're going to do is we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in, okay? And so, with this vignette, we've got a 36-year-old woman, and, generally in clinical questions, demographics are going to be the first thing that you're given. Okay, so you definitely want to make note of that. Automatically can start to clue you in on what kind of things you should be thinking about, okay? And then they often tell you, why are they coming to see the doctor? Why are they in the ER or the hospital? And in this case, it's because of difficulty and discomfort swallowing solid foods, okay? So you want to make note of that. Those are called the presenting signs and symptoms, okay? Now, a lot of times they'll also tell you how long it's been going on for. Is it more of an acute issue, like a couple days, or more of a chronic issue, like a few months? Okay, here we're told it's 2 months. You want to make note of that. Then they obviously tell us some more important clues about solids versus liquids, some other information as relates to the hands, the fingers, things like that, okay? Obviously, you want to make note of any abnormal physical exam findings and even some pertinent negatives, some things that are normal but could still be important to answering the question. Now, in this question, they're asking us what could be detected, what's most likely to be detected on laboratory evaluation. So I think we've got a couple steps here. I think one, we've got to figure out what's going on in this patient, what's the condition, what's the diagnosis, and then two, what would you see on laboratory evaluation of that patient? So I think we've got a two-step question here. So let's go ahead and let's take a look at those answer choices. And what we see here are 5 answer choices. And when we work with students, we actually recommend that students start at the bottom, answer choice E, and work their way up to the top, answer choice A, starting at the bottom, going to the top. And the reason we recommend that is because a lot of times we'll see students who start at the top, they'll see something they like, and they'll select it without going through all the answer choices. So sometimes, as a result, we'll get that question wrong. So we recommend doing it this way to prevent yourself from biasing yourself and making that mistake. So let's go ahead and let's do that now. Answer choice E, IgM anti-IgG antibodies. D, anti-centromere antibodies. C, anti-Smith antibodies. B, anti-SCL70 antibodies. And A, anti-LA antibodies. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paros. The poll is open. So we're going to give all of you a few moments here to lock in your answers. Remember that there is no penalty for guessing on test day, and certainly not one tonight. So if you're unsure what the answer is, don't worry. Just take your best guess, and we'll talk about the incorrect and correct answers once about 2/3 of you have responded. All right, I see responses coming in. We'll give all of you a couple more seconds here. And let's take a look and see what you selected. In first place with 48%, we had anti-centromere antibodies, and in distant second place, we had anti-SCL70 antibodies. So let's take a look and see what the correct answer is. And the correct answer is D, and 48% of you got it right. So a strong start to the evening here. Let me hand it off to Paris.
Thank you, Sean. Yes, great job, guys. Definitely one of those tougher MSK rheumatology type questions. So let's take a look at what's going on here, okay? So we've got a patient who has a female patient, a younger female patient, okay? And she's got a few things going on. She's having some dysphagia, some difficulty, discomfort swallowing. She's having hand sensitivity to cold weather that might be getting at Raynaud's syndrome, okay? And also some edematous skin that's also thick in the hands, okay? That could be getting at sclerodactyly, which is tightening of the hands in scleroderma, okay? And on top of that, some small subcutaneous nodules on the forearm that might be getting at calcinosis or calcium deposits in the skin, okay? So let's take a look at the next slide where we look at scleroderma, okay? This is basically where you get sclerosis or thickening, puffiness and tightness of the skin, okay? And the main differentiating point is you want to determine, is this more diffuse scleroderma or more limited scleroderma? Diffuse scleroderma is when you have thickening of your skin beyond just your fingers, so up to your arms, your mouth, your legs as well. And on top of that, you have more organ involvement as well. So your kidneys might be affected more, things like that. And you can see that that's associated with anti-SCL70 antibody, okay? Now this patient has more of limited scleroderma and previously known as CREST syndrome. And it's a very nice mnemonic. Makes you remember the things you need to think about in limited scleroderma. Calcinosis, which our patient had, also anti-centromere antibody, like you guys selected. Raynaud's phenomenon, which is when your fingers turn certain colors, you can get pain and discoloration in the cold. Esophageal dysmotility, which is what our patient had, some trouble with her esophagus with solid foods. And sclerodactyly, which is tightening of the fingers and digits. Okay, so it doesn't really extend beyond the fingers and hands. And also telangiectasia, so patients may get these fine blood vessels on their hands, on their face. That's the T in CREST. So like you guys selected, this is CREST syndrome, and you can have positive anti-centromere antibodies. Now let's go back to our question, in case you selected some of the other answer choices. So like we talked about, anti-SCL70 antibodies, that's getting more at diffuse scleroderma or which would be different than what we're talking about. IgM, anti-IgG antibodies is getting at a few different conditions, which specifically, rheumatoid arthritis is one. Not really hearing too much about, joint pains and arthralgias and such. Anti-Smith antibodies is getting more at lupus, so I would expect more of like a rash on the face, or ulcers in the mouth, some other laboratory abnormalities. Anti-LA antibodies you can see in a few conditions, but specifically also Sjögren syndrome, where you get dry mouth and dry eyes. Not what we're hearing here, so great job on this first question.
Well, thank you very much, Paris. Great explanation as always. Let's move on now to our second question of the evening. Once again, the answer choices are covered up. That is by design, and we will begin with the lead-in. Which of the following patterns of joint injury is most likely in this patient? Which of the following patterns of joint injury is most likely in this patient? Once again, we'll give all of you a few moments here to respond in the question box and let us know how many steps you believe this question will require. And then we'll take a look at that vignette. All right, we'll give all you a couple more seconds here. All right, I see some responses coming in. Let's take a look at that vignette. A 72-year-old woman comes to the clinic because of chronic joint pain and stiffness. The pain is worse throughout the day and is relieved by inactivity and ibuprofen. On examination, there is stiffness and limited motion of the involved joints without joint effusions or redness. Erythrocyte sedimentation rate is normal. Sorry about that. Which of the following patterns of joint injury is most likely in this patient? Boris.
Thank you, Sean. So what we're going to do is, once again, we're going to show you what we think are the important clues in this vignette and lead-in. Okay, so we've got a 72-year-old woman, so now an elderly patient. Okay, she is coming to be seen because of chronic joint pain and stiffness. So we know it is a chronic issue. Okay, so when we are told about joint pain, things we want to know: where is the joint pain? Is it better in the morning? Worse in the morning, worse at night? Is it better with activity, worse with activity? And specifically, which joints are involved? And you can see some of those things are actually told to us, and so we want to make note of that. Okay, so this question is asking us about pattern of joint injury most likely. So I think we've got a couple steps. I think one, we've got to figure out, based on this clinical vignette, what is our most likely diagnosis? And then two, in that diagnosis, what is the common classic pattern of joint involvement? So I think we've got another nice two-step question. So once again, let's take a look at that answer choice, the answer choices, and we'll start at the bottom and work our way up to the top. Answer choice E, symmetric proximal and distal interphalangeal joints. D, symmetric metacarpophalangeal. C, sacroiliac and intervertebral. B, monoarticular metatarsophalangeal. And A, monoarticular knee. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Well, thank you very much, Boris. Yes, the poll is open. Once again, we'll wait until about 2/3 of you have responded. Keep in mind that we do have a raffle and special offer for all of you in attendance, so make sure you stick around until the end. All right, I see the responses coming in. We'll give all of you a few more moments here. Looks pretty close so far. All righty, almost there. A couple more seconds here. All righty, let's take a look and see what you selected. 31% of you selected A, monoarticular knee, and 28% of you selected symmetric, proximal, and distal interphalangeal joints. So let's take a look and see what the correct answer is. And the correct answer is E, and 28% of you got it right. So a challenging question. Let me hand it off to Boris.
Thank you, Sean. Yes, definitely a challenging question. So let's take a look at what's going on here. Okay, so this patient has chronic joint pain, and it's worse throughout the day. Okay, and it is relieved by inactivity or rest. These are signs that this is osteoarthritis. Okay, on top of that, the ESR is normal, meaning that there's not a lot of inflammation going on. Okay, if we take a look at the next slide, we can take a look and kind of compare osteoarthritis with rheumatoid arthritis. And you can see there, osteoarthritis, the presentation is pain in weight-bearing joints after use that improves with rest. Okay. Now, on top of this, if we then take a look at rheumatoid arthritis, we can see that that actually presents more so with morning stiffness, okay, improving with use. Also some systemic symptoms as well, fever, fatigue, potentially elevated ESR, CRP, rheumatoid factor, okay? So if we go back to our question, if we take a look at the answer choices, answer choice E, the proximal and distal interphalangeal joints, is commonly what we call Heberden and Bouchard nodes. Okay, so you can get involvement of your DIP and PIP joints. Now with rheumatoid arthritis, you classically do not get involvement of your DIP joints. Okay, so that would be a key thing to look out for in these answer choices. And that's why answer choice E is the best answer here. D is a little bit more consistent with rheumatoid arthritis, involvement of those MCP joints. C is more consistent with ankylosing spondylitis. B is more consistent with gouty arthritis, so if you were to have a history of gout or anything suggestive of that. And then A is a little bit more concerning for pseudo-gout, which usually can involve some of the larger joints, usually one joint. Okay, so another tough MSK question here, but just important to keep in mind some of those different presentations between your different arthritides.
Well, thank you very much, Boris. Great job once again, everyone. Now, we talked about RX Coach earlier. RX Coach is our one-on-one coaching and tutoring program where we work with you individually to help you identify your strengths and weaknesses, figure out which learning style works best for you, help you make a personalized study plan, work on your test-taking skills, and really maximize your potential on test day. So whether you're studying for an exam in med school, a comp exam, or one of your board exams, if you want to put your best foot forward, take the guesswork out of studying and have somebody work with you individually to create a plan that's individualized and personalized towards you, reach out to us at RX-Coach or RX-Coach.com. You can set up a free consultation to talk about our coaching program and how it can benefit you. So once again, that's RX-Coach or RX-Coach.com. Let's move on now to our third question of the evening. As always, the answer choices are covered up, and we will begin with the lead-in. This patient will most likely experience weakness in which of the following movements? This patient will most likely experience weakness in which of the following movements? Once again, we'll give all of you a few moments here to respond in the question box and let us know how many steps you believe this question will require. And then we'll move on to that vignette. All right, a couple more seconds here. All righty, let's take a look at that vignette. A 35-year-old sanitation worker comes to the clinic with severe lower back pain that began suddenly as he was lifting a heavy load. He describes the pain as sharp and radiating down his left leg and foot. He does not report bowel or urinary incontinence. The pain is reproduced when the patient's left leg is lifted at a 30-degree angle. Ankle jerk reflex testing reveals 1+ on the left side and 2+ on the right side. Sensation to pinprick is diminished markedly on the lateral portion of his left foot. This patient will most likely experience weakness in which of the following movements? Boris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this question. Now, this is a very common question that you're going to get, not just in step 1, but step 2 CK as well, that patient who's coming in with back pain. Because it can be a lot of things. It can be some, more benign conditions, some more musculoskeletal things, to some more complex conditions that you don't want to miss. Okay, so you want to make sure you're picking up on all the clues here to make sure you really nail down that diagnosis. Okay, so this is a 35-year-old, and right off the bat, they're telling you this is a sanitation worker. Okay, so whenever they tell you something right off the bat, this is a sanitation worker, this is a 40-year-old alcoholic patient, automatically you want to incorporate that and ask yourself, why are they telling me this so early on in the vignette? Okay, so don't forget to take note of that clue. Now in this question, they tell us that the pain began suddenly after lifting a heavy load. So we know that there is an inciting event here, okay? So when you talk about back pain, you want to ask, is it dull? Is it sharp? Does it radiate anywhere? And if so, where does it radiate, okay? Do you have any incontinence? Now in this patient, he doesn't, but you want to make note of that. And then obviously, in a very important neurological exam, you want to make note of all the things that are abnormal and even some pertinent negatives as well. Okay, they tell us about some issues with lifting the leg, reflex testing, as well as diminished sensation in certain areas. So you want to use all of this to try to localize what's going on. Okay, so this question is now asking us, this patient may most likely experience weakness in which movement? Okay, so I think we've got a couple steps here. I think one, we've got to figure out what is going on, what's the condition, what's the diagnosis, what is, without giving too much away, what is being affected in that condition, and then 3, whatever is being affected, what movement does that also help you with, okay, where you might experience weakness. So I think we have a 3-step question here. Okay, so let's go ahead and let's take a look at those answer choices. And what we see here are 5 answer choices. Once again, we're going to start at the bottom and work our way up to the top. E, toe extension. D, plantar flexion of foot. C, knee extension. B, hip flexion. And A, dorsiflexion of foot. So once again, we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Well, thank you very much, Boris. Question number 3. Let's try to keep the momentum going. And of course, like I said, we do have a raffle and special offer. If you're wondering, next week's topic is endocrinology. And of course, if you have suggestions on which topics you'd like us to cover, please let us know in the question box. All right, see the responses coming in. There seems to be a clear favorite so far. Let's see if it holds. Couple more seconds here. All righty, and let's take a look and see what you selected. It was a little close. 38% of you selected plantar flexion of the foot, and 33% of you selected dorsiflexion of the foot. So let's take a look and see what the correct answer is. And the correct answer is D. So that was the number 1 choice. So great job, everyone. Let me hand it off to Paris.
Thank you, Sean. Yes, great job with this question. So you can see that there are a few steps here. So great job on nailing down those steps. So step number 1, what is the most likely diagnosis? Well, I think you guys picked up on that. There's an inciting event of lifting a heavy load. And so this patient probably has a herniated disc. Okay. We also know that this patient has a positive straight leg test. So when that leg is lifted, when straight, you can reproduce the pain. Okay. So a positive straight leg test, which is also suggestive of a herniated disc that is kind of pushing on those nerve roots. Okay. So now the question is, what is being affected? Okay. Now we know that this patient has a weak ankle jerk reflex on the left side compared to the right side. Normal reflexes are 2+. It's only 1+ on the left. We also know that there's sensation that's diminished on the lateral side of the foot. So let's go ahead and let's take a look at that next slide. okay? And what you can see here is the basic dermatomes, okay? And you can see here when looking at that far, either the far left or far right image, you can see that the lateral portion of the foot is primarily S1, okay? So we know that the S1 dermatome really captures a good portion of the lateral portion of the foot. So automatically, hopefully you guys have S1 starting to think that. But let's also see if that makes sense with that ankle jerk reflex, okay? When we take a look at the next slide, okay, we can also see, looking at that table with the 3 columns, on the far right, you can see what happens if you have an S1 nerve root affected with the herniation. You can see that there is a decreased Achilles reflex, just like our patient had. Okay, so that also makes sense, 2 for 2. On top of that, what are some other clinical findings? Well, difficulty in toe walking and weakness of plantar flexion, which was the correct answer here. Weakness of dorsiflexion would be more indicative of an L5 radiculopathy. Weakness of knee extension would be more indicative of L4 radiculopathy. Okay, so it's important to know these key findings because a lot of times in these questions, those 1 or 2 clues can automatically tell you, hey, this is S1, this is L5, and boom, you can get the question right. Okay, so let's go back to our question and our other answer choices. Take a look at the other answer choices. So answer choice E would be getting at L5 radiculopathy. Knee extension, as we mentioned, anywhere from L2 to L4, but primarily L4 radiculopathy. Hip flexion could also be L2 to L4 radiculopathy. Then lastly, A, as we talked about, dorsiflexion of the foot, that would be more L5 radiculopathy. So great job with this question. We'll move on to the next question.
Well, thank you very much, Boris. We got 1 question left. Let's try to finish strong. As always, the answer choices are covered up, and we will begin with the lead-in. Which of the following is the insertion site of the muscle most likely involved in this patient's condition? Which of the following is the insertion site of the muscle most likely involved in this patient's condition? As always, we'll give you a few moments here to respond in the question box and let us know how many steps you believe this answer choice will require, and then we'll move on to that vignette. I see a lot of questions coming into the question box. Please remember that we're trying our best to answer those for you, but if for some reason you need to listen to the explanation again, don't worry, I'll share a link with you later where you can watch this webinar again. All righty, I see the responses coming in. Let's take a look at that vignette. An 18-year-old woman comes to the clinic with a 1-week history of right hip pain. She runs track and reports that she first noticed the pain after jumping hurdles. The pain is achy on the anterior of the right hip and worse with activity. She also has noticed a popping noise in her hip. On physical examination, there is tenderness to deep palpation over the anterior hip. The hip is passively extended and internally rotated, which reproduces the pain and popping noise. Hip flexion against resistance also reproduces the pain. Which of the following is the insertion site of the muscle most likely involved in this patient's condition? Boris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. This is kind of our 4th time doing this now. So hopefully you guys are starting to pick up on, in these MSK questions, what do you need to be looking for to really get this question right, okay? So now we've got an 18-year-old woman, and they tell us that she has right hip pain for 1 week, okay? They tell us immediately that she runs track as well, okay? So obviously going to be important here. She gets pain after jumping hurdles, and then they tell us where the pain is, okay? And obviously with this pain and hip pain, there's going to be some physical exam maneuvers, and you want to make note of that and try to figure out, based on those abnormal physical exam maneuvers, what's going on with this patient, okay? So you want to make note of all those clues and try to pick up on what's going wrong. So I think in this question, we've got a couple steps here, okay? I think 1, we've got to figure out, what's going on with this patient, Okay, what is the issue in this patient? What muscle might be affected? 2, what is the insertion site of that muscle? Okay, so I think we've got a couple steps here. So let's go ahead and let's take a look at those answer choices. And we will start at the bottom and work our way up to the top. E, pes anserinus. D, patellar tendon. C, lesser trochanter of the femur. B, ischial spine. And A, greater trochanter of the femur. So once again, we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Well, thank you very much, Boris. This is our last question before we do our raffle and special offer. So let's try to finish strong. We'll give all of you a few more moments here to lock in your answers. All right, I see about half of you have responded. We'll give all of you a few more moments here. Looks pretty close so far. All righty, let's take a look and see what you selected. 37% of you selected greater trochanter of the femur, and 34% of you selected lesser trochanter of the femur. So let's take a look and see what the correct answer is. And the correct answer is C, lesser trochanter of the femur, and that was selected by 34% of you. So let's hand it off to Boris so we can make sure we nail it on test day. Boris.
Thank you, Sean. Let's go ahead and let's take a look at what's going on. Definitely another tough MSK question, but definitely fair game, okay? And you can see here that they're not just giving you, hey, what is the insertion site of XYZ muscle? They're giving you a clinical vignette. So they're adding another step. And this kind of goes hand in hand with what the USMLE is trying to do and really make things a little bit more clinical, okay? So this patient is a track runner who does hurdles, okay? And so one of the common things that you can see in these patients is iliopsoas tendinopathy, where the iliopsoas tendon is inflamed because of overuse. How that presents usually is an achy pain in the front of the hip that worsens. You can have a popping or clicking noise, and usually reproduced when you extend and internally rotate that hip, okay? You can also have tenderness if you were to do deep palpation, which is what our patient has here. So common sports that require repetitive hip flexion is where you might see this. So track and field, doing hurdles, ballet, gymnastics, some common sports to think about. Now, if we take a look at the next slide, knowing that the iliopsoas is most likely affected. Now, this is a combination, a complex of your psoas major and iliacus muscles. And you can see here that they insert at the bottom. You can see that they're kind of wrapping down and inserting on that lesser trochanter of the femur, okay? So that is why this muscle acts as a hip flexor. It basically pulls on that hip to flex it, okay? So that's why answer choice C is the best answer. So let's take a look at those other answer choices. The pes anserinus is a conjoined tendon of a few muscles, so not exactly what's going on. The patellar tendon is the insertion point primarily of your quadriceps muscles, so your rectus femoris, vastus lateralis, medialis, and intermedius, and so a little bit of a different muscle group affected. Answer choice B, ischial spine, that's actually more of the origination of the iliopsoas. And then your greater trochanter is the insertion point of your gluteus medius minimus, your obturator, so a little bit different than what's going on here. So great job on these MSK questions tonight. I will pass it back to you, Sean.
Well, thank you very much, Boris. Great job as always. For those of you who want to take another look or a deeper look at the questions we did tonight, simply take a picture, a screenshot, or make note of these QIDs. You can log into USMLE-Rx and simply enter these numbers into the Rx search field, and they'll pop right up for you. So I'll give you a few moments here to make note of these QIDs.